It's Monday, April 4th, 2011. In this week's BeakerBeat, J&J takes a tough love approach to its problem child McNeil Consumer Healthcare Unit. More on that. Plus, insider trading is illegal, highly profitable, and has lined the pockets of many members of Wall Street, corporate America, and the FDA? We'll explain. And how intense exercise, including sex, can kill you. Don't worry though, we're here to help keep you alive and happy. All that and more in this week's edition of BeakerBeat. Brought to you by Daiichi Sankyo. To learn more about Daiichi Sankyo, visit their company webpage on Beaker.com. Hello everyone, welcome to this week's edition of BeakerBeat. I'm Mike Justice, thanks for tuning in. Well, J&J has a problem child on their hands. What do you do if you're a wealthy American company, family, and you have a problem child? Typically, you pack them up and send them on their way. J&J is doing just that. Breaking up is hard to do, but sometimes it has to happen. Johnson & Johnson is breaking up its troubled McNeil Consumer Healthcare Unit, splitting it into pieces by geography and product type. This move will allegedly allow closer focus on the U.S. consumer drug operations that have been battered by so many recalls over the past 18 months. J&J's vast consumer business has been one business unit, marketing everything from baby wipes to Tylenol. Now, under the umbrella of a new global franchise organization, the product lines will be organized into four categories: OTC drugs, skincare, oral care, and women's health. Regional divisions, North America, Latin America, etc., will market all of the product lines. Except for one big difference: the U.S. OTC business. That's the problem child responsible for most of J&J's long series of recalls and is comprised of 3 plants now subject to an FDA consent decree. As the Wall Street Journal reports, Jesse Wu, recently appointed to head up all of J&J's consumer businesses, told employees that he is making McNeil separate, quote, in order to give focused attention to quality and compliance and the critical task of restoring the OTC product's once sterling image. Easier said than done, though. As I recall, promises to clean things up happened months ago, yet more and more recalls are occurring. In fact, another odor-related recall is in the works. Complaints of a musty, moldy smell emitting from Tylenol 8-hour caplets prompted J&J to pull 34,000 bottles. Plus, the company added another 717,000 packages of 5 different drugs to a January consumer med recall, saying that production equipment might not have been cleaned properly. These 2 episodes bring J&J's recall count to more than 20, and both involve drugs made at the company's troubled Fort Washington, Pennsylvania plant before it was shuttered last April for retooling. That according to Dow Jones. That plant, along with McNeil facilities in Puerto Rico and Lancaster, Pennsylvania, is now operating under an FDA consent decree. The Fort Washington facility won't be able to resume production until the agency gives its blessing. So tell us what you think about this story or any story that you see in today's show. It's very simple. Click on the orange button below me. A box will pop up. Type in your comments, send it to me. I promise I'll read and respond to every one of them. And when you're done watching BeakerBeat, check out Beaker's blog and find out how opponents of the medical device tax are fighting back. And could the next big blockbuster drug be something you smoke? Stunning sales figures for the wacky tobacco. Those stories and more on Beaker's blog. Insider trading usually only happens on Wall Street or in corporate boardrooms. Not the FDA, right? Chengyi Liang, a chemist at the FDA, and his son Andrew Liang have been arrested and charged with insider trading. NPR reports that the elder Liang had access to FDA's internal database that included upcoming announcements regarding drug approvals. So, with the help of his son, he allegedly traded on that information to make more than $3.6 million since 2006, according to a statement by the U.S. Securities and Exchange Commission. The SEC says that he benefited from 27 insider trades, including ones of stocks from Clinical Data, Momenta Pharma, and Vanda Pharma. The SEC alleges that Liang went to great lengths to conceal his insider trading, using 7 brokerage accounts, none of which were in his name. One belonged to his 84-year-old mother, who lives in China. Canada's Valiant Pharma has gotten angry, attempting a hostile takeover of Cephalon after private offers were refused. Valiant is offering $5.7 billion for the business at $73 per share, but threatening to walk in a month if investors don't take the deal. If it's successful, Valiant will gain a blockbuster narcolepsy drug and a pipeline of cancer therapeutics that has been beefed up in recent weeks through new acquisitions. Cephalon recently agreed to acquire Geminex and ChemGenX. That makes 7 acquisition deals in the past year. Valiant CEO J. Michael Pearson said that the offer could even go up. Quote, while we are willing to consider a higher price if due diligence supports this, we will remain very disciplined on price, he told analysts. Translation, we're buyers as long as it's not crazy money. Now, since it acquired BioVail last summer, Valiant shares are up 66%, and the company made it clear in January that it would pursue new acquisitions to further grow the business. Time for some quick hits now, and after causing a big stir, a new cancer treatment will be paid for by Uncle Sam.
Dendrion's prostate cancer vaccine Provenge will be fully covered for Medicare patients under a proposed payment plan from the CMS. The $93,000 treatment will get coverage for its FDA-approved use in men with advanced metastatic prostate cancer. The decision comes after a roller coaster few months that began when CMS announced that it would actually review payment for Provenge rather than its usual tactic of automatically extending coverage to new FDA-approved drugs. That's when the controversy started. Some politicians suggested that the CMS review amounted to rationing of health care. Others wrote angry letters to the agency. Patient advocacy groups criticized the review, and Dendrion investors complained, knowing that Medicare would be the primary payer for Provenge. Losing it would be an enormous blow to the company. So now, everyone can breathe and relax. Starting next year, a government disclosure mandate takes effect, requiring drug makers to collect data on their payments to doctors and report that info to the feds beginning in 2013. Some companies, however, like Merck, are already voluntarily providing this information. Merck's group of doctor speakers exceeds 2,000 members and accounted for $20.4 million in payments last year, according to MarketWatch. The drug maker posted the payment information on its website, adding to previous payment disclosures for the second half of 2009. 3 months after the CDC recommended all adults over the age of 60 receive Merck's Zostavax vaccine, the FDA has approved the shingles preventative for use in adults ages 50 to 59. The FDA approved Zostavax for adults over 60 5 years ago. Approximately 1 in 3 people will develop shingles at some point in their lives. The FDA took into account a recent study showing Zostavax cut the risk of developing shingles by 70% in 50 to 59-year-olds. This is becoming a disturbing trend. Parents' reluctance to get their kids vaccinated has led to an outbreak of 6 cases of measles in Minnesota. 2 were unvaccinated, while 4 others were too young to receive the MMR vaccine. Meanwhile, an outbreak of pertussis at La Cañada High School in California has led administrators to push for student vaccinations. We here at Beaker think vaccinations are a pretty good idea. Ex-GlaxoSmithKline lawyer Lauren Stevens is off the hook, for now anyway. Reuters reports that a federal judge tossed out her indictment on charges of obstructing an investigation of the company's marketing practices. The judge said prosecutors screwed up when presenting their case to the grand jury. Stevens had been accused of disrupting an FDA investigation into GSK's Wellbutrin marketing, partly by making false statements about the company's practices. Checking money matters now, and Novartis announced the deal that will help it beef up its presence in China. Novartis has purchased an 85% majority stake of vaccine maker Zhejiang Tianwan. The Chinese company produces several vaccines and has several other products in various stages of development. China is the world's 3rd largest vaccines market with annual industry sales of more than $1 billion, and analysts expect sustained growth in the future. Waltham Mass-based PerkinElmer has agreed to buy CambridgeSoft for $205 million. CambridgeSoft is a provider of discovery, collaboration, and knowledge enterprise solutions, scientific databases, and professional services.
Little Federico Manuel.
Oh, no, wait a minute, don't say it. Oh, this is the biggest one I ever had. You hear that, Elizabeth? I'm coming to join you, honey.
Well, the truth is we're all getting older. The big problem with getting older is that you think you can do things you used to do, but you really can't. Like, say, playing basketball. All of a sudden, you're pulling a hammy. Chasing the kids out of your lawn. All of a sudden, you blow out your Achilles or something like that. Well, the truth is that this could be even more dangerous than you think.
If this doesn't get you to exercise regularly, then nothing will. According to a new study, sudden bursts of moderate to intense physical activity, such as jogging or having sex, significantly increase the risk of having a heart attack. This is especially true for people who do not get regular exercise. Doctors have long known that physical activity can cause serious heart problems, but the new study helps to quantify that risk. The team analyzed data from 14 studies looking at the link between exercise, sex, and the risk of heart attacks or sudden cardiac death, which is a lethal heart rhythm that causes the heart to stop circulating blood. They found people are 3.5 times more likely to get a heart attack or have sudden cardiac death when they are exercising compared to when they are not. And they are 2.7 times more likely to get a heart attack when they are having sex or immediately afterward compared with when they are not. Now, the risk is fairly high, as such studies go, but the period of increased risk is brief, lasting only for about 1 to 2 hours during and after the physical or sexual activity. Researchers say it is important to balance the findings with other studies, showing that regular physical activity reduces the risk of heart attacks and sudden cardiac death by 30%. Jessica Paulus, a Tufts researcher who worked on the study, said, quote, "What we really don't want to do is for the public to walk away from this and think exercise is bad."
So the bottom line is, for those of you who are not exercising regularly, you need to get started, but start out slow and then slowly build up the intensity. As for your bedroom performance, don't pull a Charlie Sheen, because that is a recipe for a heart attack. Well, that's it for this week's edition of BeakerBeat. I'm Mike Justice. Thanks for tuning in. We'll see you next week.
Sit, Beaker. Sit. Good dog.